Movement analysis. Movement analysis is a great way to take the static posture that you're assessing and see what is happening during movement. I'm going to give you two examples in gait and in a squat range test. So the first example is there's many different things going on in this woman's structure, but the main point that I want you to look at here is her valgus stress in her leg. So if I put the line of gravity right at the heel there, and on that heel we can see that her legs are coming into this valgus stress or knock knee. So the question is, how does that relate to her gait? And also, what is happening to her feet when she walks? So this is just one aspect that I want to look at with this movement analysis. Okay, we have two videos here. And this is her in gait in a before and after. The before video that you see here was taken at the same time as that first photo I just showed you. And we want to see what her valgus stress looks like while she's walking. And so in the before video, as we scroll this through in a slow motion, we can see that especially in a mid-swing, as her foot, when her heel comes off the ground, you can see that her foot is turned out to the side. So she's got that eversion going on in her feet. So we'll leave it there. Then on the after, we can see that as her heel comes off, that her heel is in a completely different position than it was the very first video that I've taken. So that's one difference. Then we're looking, like I mentioned earlier, we're looking for that valgus stress. And so when she loads that left leg, what does that valgus stress look like? We use the line of gravity, we'll place it at her heel, and place it at her heel here. Okay, and we can see that as she's swinging that leg through, right in the mid-swing there of her gait, that the stress on this left knee in the before video compared to the right knee, we have ankle, knee, hip lining up as she loads that left leg. And excuse me. And we can see here that the valgus stress is greater on that left side in the before video. So that's an example of gait, how you can track the movement of your work in gait to be able to see what kind of difference there is. So there's many different things that we can point out in this video. However, that's just one thing that I want to show you in movement analysis, that these are tips that you can look for in the same deviations that you're looking at when you look at a static posture assessment. You can bring those type of deviations into movement with her foot turning out, eversion of the foot, or that valgus stress and how she's loading that left side compared to the right side. And there's those sort of things you can look for in movement analysis when you're taking video. Second movement analysis that I'm going to show you, and there's many more that you can do, you can get really creative with this, is a really common assessment in personal trainers and physical therapy and movement work, is a squat analysis. So in this particular squat analysis, what I want to show you is if you line the person up in as close to the same spot as you possibly can, you can have a movement analysis that's pretty darn accurate. For instance, in this case, I learned something with this feature and tool that we have inside the app that I would not have saw unless I actually had this type of thing. This is our superimpose feature. And if we go ahead and have her squat all the way down, and the videos are linked up right now, and we get into right there in that position, right, her end range of the squat where she settled in. Now, this is the before, the baseline of the squat before, and what I want you to pay attention to is her thoracic spine. And as I shift over to the after image, we can see a shift in her spine. Her thoracic spine, it gets straighter, and then her pelvic tilt shifts, and even her knees change position, deepening her squat in this position. Where you can also see right in her chest, her breasts actually come forward. So that's a sign of the thoracic rib cage opening up, and that's exactly what I worked with her on. Is she had a lot a lot of compression in her thoracic spine that was affecting her abdomen, especially her abdominal pressure. She's a CrossFit athlete, and so what she was experiencing was urination, uncontrolled urination when she was doing a front squat or a back squat or double unders. And this is really common in the CrossFit community, where they have a weakness in the pelvic floor, and it has a lot to do with the abdominal pressure and rib cage positioning, because once the rib cage changes its position, it changes the abdominal pressure and can weaken the pelvic floor. So you can load heavy on a back squat or a front squat, drop all the way down, and on the way back up, it's really common for these women to urinate uncontrollably because there's so much pressure being put on the pelvic floor, and the pelvic floor can't handle it because of what's happening in the abdominal pressure. So we worked with the rib cage, and the rib cage opened up, changed her abdominal pressure, basically abdominal pressure, and she's got more access to transverse abdominis muscle and the pelvic floor, so that helps strengthen her pelvic floor. So in this is a month later, she's no longer actually urinating anymore when she does a front squat or a back squat or double unders. But in this one here, you can see that the rounding of the thoracic spine, you can see that in her sports bra, her breasts actually change position because her rib cage is changing position. Her neck changes position. She actually gains a little bit of height in her head. You can see that in the chart behind her. She's more compressed there, and then she actually grows a little bit. So her spine has absolutely lengthened. Her rib cage has decompressed. Her abdomen or abdominal cavity has changed its pressure to less pressure on the pelvic floor, resulting in a better performance when she's doing her back squats, her front squats, and her double unders when she's working out. So those are great examples of things that you can do. These are pretty classic baseline tests that I always take. I do a gait analysis, and I do at least a squat test. I might do a hanging test. I might do something where someone's has their hands and knees. They're on their hands and knees like a cat-cow in yoga to see what the spinal extension and flexion is of the spine. And you're trying to get as best placement as you can. You're going to be able to utilize these tools inside the app in a way that will give you a lot of information about your work. So that's tips on movement analysis.